Hello guys, I will complete my assessment. So I was on disability. When you done your checked your patient is alert, verbal, responsive or unresponsive, then afterwards you need to ask the patient, have you passed your urine, or do you for alertness you can ask, do you know where are you when you pass your urine. Then you can confirm my patient is alert if he's answering the correct. And then if patient is not answering correct or might be confused, then you can put the confused. And then you can ask other questions. Are you diabetic? If patient say no, can I check your baseline blood sugar levels? And then afterwards, you, as earlier, and then you can ask the pain, do you have any pain? If patient say yeah, I got a pain, then you will give the pain scale 0 to 10. 0 is the least and 10 is the worst. And then if patient says I do have pain, it's score of 3, then you can say, oh, you are having mild pain, so sorry to hear that. Do you have any painkiller before? Patient say no. Do you want painkiller? If patient says yes, then you can tell the patient, are you happy to carry out the assessment? Then afterwards I will see the medication administration record. If you've been prescribed for any painkiller, then I will arrange the painkiller for you. Is that okay? Or do you want me to reposition and to support your back with the pillow? Is that okay? And then patient say no, I'm happy. You can carry out your assessment. Then afterwards you will ask the patient, is there any changes in elimination as well? And then afterwards you will go for exposure. You can ask the patient, do you have any rashes, bruises, any cuts which I can't see on your body, any bruise, rashes, injuries? Yeah. If patient say no, and then afterwards you will ask the patient about medical history. You will get in your paperwork which was given by the examiner. So for example, if patient is you can ask the patient, I can see in the record you are diagnosed with hypertension for which you are taking amlodipine tablets or losartan, and I can see you are having you are a diabetic for which you are taking glycoside and metformin. So is that all right? Or so patient say okay, yes. Then after you confirm medical history, you will ask the patient, you will tell the patient, I done the assessment which is not completed fully yet, so I'm just going to write down my observation in my chart. Then I will be back to you in few seconds, and then I will carry out my assessment. Is that okay? I'll ask you a few more questions. Is that okay? Are you happy me to do? And then patient say yes. And then you will gel your hands, and then you will write on the observation, and then you score it, and then you will gel your hands again, and then you will approach the patient. You will tell you got score either 1, 2 or 3, 4, 5, and you will escalate accordingly the score according to the news to score policy. Then afterwards, when you done score, then you will ask the patient about social history. These are very important. And then you will ask whom you are living with. Are you living alone, or are you living with your family? So what are your hobbies? Are you working? Are you retired? And then other things very important, the daily activities of living. These are very important in assessment. So you will ask the patient, how do you normally mobilize? How do you normally manage daily activities of living, such as washing, dressing, bathing, or personal care? Do you think there's any changes in your sleeping pattern or eliminations, any urine output, any you think you got any increased anxiety? Do you have any changes in your appetite? Do you think you reduced appetite, or you are eating more than before? So these things are very important, and you will make a care plan on those assessment. So assessment will be on the plannings depended on your assessment, how you done. So for example, you will make a care plan for during assessment pain, and then what a patient is telling you during the daily activities of living, what is the main concern for the patient. So when you all done daily activities of living, social history and medical history and new charts, and then you will record the in care plan as well. You will tell the examiner, I will document all assessment in the patient's care plan, and then you will reassure the patient and will explain, I done all the assessment, thank you for your cooperation. And then you will tell the patient, here's the call bell, if you need any help you can press the bell, so we will come to help you, to support you. Is that okay? So then afterwards you will say, okay, are you in do you want painkiller? As earlier you told you are having pain. If this patient said no, I'm okay now, then that's fine. If patient, yeah, I'm still want painkiller, then you will tell the patient, I done my assessment, I'm going to check medication administration record, then I will arrange the medication for you. So then afterwards you can tell the examiner, my scenario is finished, so my station is finished, thank you so much. You will wash the hands according to WHO guidelines, and then you will clean the equipment for the next person to use. Clean and wipe. Thank you.